Quality Control by Haley Sellers. Our topic is indwelling urinary catheters, and our goal is to reduce the associated infections. After speaking with my unit manager and preceptor, the problem seems to be that urinary tract infections have been occurring more frequently in the past 6 months than in the previous 6 months. An article by Novotny, 2013, said that 80% of all urinary tract infections are associated with an indwelling catheter, and 13,000 deaths a year are a direct result of urinary tract infections. Nationally, the healthcare industry pays $400 to $500 billion every year due to CAUTIs. These statistics are Another study by Finley, Coonan, and Stickler, 2012, stated that indwelling urinary catheters are the leading cause of infections in healthcare settings. Healthcare settings being not only hospitals, but nursing home facilities as well. The catheter design provides an ideal habitat for bacterial growth. Patients with prolonged catheterization have an increased mortality rate. Patients requiring catheters generally have a longer hospital stay, costing more money and decreasing the chance for a positive outcome. I'll read over a few of our improvement problem worksheet. Define agreed upon project and goals. Do you have senior leadership buy-in, yes or no? Yes. A decrease in CAUTIs improves patient outcomes, saving lives and money. That's a win-win in a hospital situation because saving lives is our ultimate goal, but a hospital is a business and cannot function without being financially stable. Customer focus. Have you clearly defined the customer who will benefit from the improvement? The patient receives the largest portion of the benefits from this project, which is always our goal in the healthcare setting. Eliminate blame. Have you defined the process, not the people, that requires redesign? Yes, catheter insertion protocols and criteria need to be redesigned. Have you defined data needs and required support for data management and analysis? Yes, need to know frequency for catheter usage, rationale behind insertion, and number of CAUTIs. Have you defined an interprofessional team creating a neutral problem-solving environment? Yes. No blame is placed in any circumstance, keeping patient safety and outcomes as the main focus. Prevention is our main goal with this project. 69% of CAUTIs are preventable with evidence-based practice guidelines. Avoid the use of catheters when at all possible with bedside commodes, pure wet catheters, condom catheters, urinals, and bedpans. Hand hygiene before and after catheterization insertion. Always use aseptic technique with sterile supplies. Use the smallest catheter size. Provide excellent perennial care with soap and water. Ensure a closed system at all times. Secure catheter tubing to leg. Make sure the drainage bag is always below the bladder. These findings were from the National Guideline Clearinghouse, 2012. Good hand hygiene is the #1 infection control strategy proven to reduce the occurrence of CAUTIs. It's always a good idea to have a system in place that prevents complacency and workarounds. The team for this project will be the unit-based council comprised of 5 nurses who have demonstrated their skills and leadership qualities, especially my preceptor, the charge nurse, the unit manager, quality control representative, and the physician champion, which my preceptor has lined up for other projects on the unit, and he is kind of our go-between in the physician-nurse conversation. This short survey will allow the team to more readily see where the teaching points are and identify any knowledge deficits. Employee knowledge survey. What are the criteria for inserting a urinary catheter? How frequently should you reassess the need for the catheter? The changes we would like to implement in our project include the use of evidence-based practice guidelines to decrease the prevalence of CAUTIs, interview peers to get a sense of compliance with protocols already in place, ensure proper hand washing by conducting a unit checkoff, ensure aseptic technique by peer evaluation, 2 nurses present during catheter insertions for checkoff, have charge nurse round on patients with catheters to constantly assess the need, Work with Meditech support for a daily Foley renewal / discontinue alert on the electronic record. The need for a Foley catheter should always be evaluated on a daily basis. That's from Pratt and Pillow from 2010. I realize that source is a little out of date, but it is not included in one of my 3. The anticipated outcomes of this project include the need for catheters being assessed on a daily basis. The amount of catheters will decrease. The ones that are no longer needed will be discontinued, thus decreasing the rate of infection. Ensure proper hand hygiene and aseptic technique will ensure a decrease in microbials, leading to a decrease in infection rates. Interviewing peers will help increase compliance and adherence to protocols by finding the underlying problems and addressing the issues as they arise. Charge nurse rounds will help ensure catheter meets criteria to remain in place, or if discontinuation should be addressed with a physician. By decreasing the number of CAUTIs, we can significantly increase positive patient outcomes. This will decrease overall hospital stay and ensure the best possible care for our patients.